Afternoon, everybody. I have 12:30 Central. I think we'll go ahead and get started. I want to thank everybody for attending our webinar today. We have an exciting topic on SAP US benefits by Benefitfocus. What we'll do, I'll walk through a quick agenda. We're going to go through some introductions on the panelists today, then provide a brief overview of Phoenix Business Consulting and who we are, and then talk about SAP US benefits. We do have a section on the public sector footprint, but this application is also perfect for commercial clients out there. And then the majority of our time we're really going to spend on the demonstration, and then we'll wrap up with any questions and answers. Okay, so on the call today, my name is Piers Manton. I'm an account manager here at Phoenix Business Consulting. I've been with the product for about 12 years, and I'd like to turn it over to Hanif Sarangi for an introduction.
Sure. This is Hanif Sarangi. I'm the president of Phoenix Business Consulting, and I've been working in the public sector for over 20 years, over 30 years in total on SAP. Damon, you want to go next?
Sure, thanks. Damon Haycock. I'm the public sector program director for Benefitfocus. Been with Benefitfocus just a couple of years. Before that, had a 15+ year career with the state of Nevada, and my last 4 running their public employees benefits program. So sat on both sides of the table when it comes to running a health plan and trying to support one. Ken, you want to introduce yourself?
Sure, thanks. Hey, everybody. My name is Ken Novak. I am a senior solutions engineer with Benefitfocus. And so I work with our really our large employer groups, public sector clients, to help understand their business needs and how we might integrate from a technical perspective and really consult on best practices to help streamline some of the processes that our customers are going through today.
Great. Hanif, would you like to bring a quick background on Phoenix Business Consulting?
Sure. I'll be really quick here because I know it's important to get right into the topic of benefits. But Phoenix has been in the industry for over 24 years now. And, we sell all of the different services, including SuccessFactors, S/4HANA upgrades, Concur, SuccessFactors, Ariba. So we sell licenses and implementation for all of these. And one of the exciting solutions that we implement and sell is Benefitfocus, and that's what we're going to talk about today. So we'll get on to our next topic. I often get asked, we have a lot of public sector customers, over 100 public sector customers, another 50 to 100 commercial customers. But one of the things I get asked about most by our public sector customers is how do I manage my benefits better? And that's why we're bringing this topic over to you. We have a lot of demand. It's one of the pain points in our these large county customers, city customers, school districts. It can stand alone, and this is one of those topics where we're excited to talk about with both our public sector customers and our commercial customers. And I just want to get right into our demo. So we can go to the next slide and right into Benefitfocus.
Yeah, thanks, Damon Haycock again. And just kind of as a brief introduction, Benefitfocus has been around since 2000. We initially got into the market to support large insurance carriers as their enrollment system. And we realized that the direct to employer was an opportunity for us to specifically support those folks like yourselves on the call to ensure that we provide the best experience and connect you to and from the various carriers. So we have both of those verticals, and we've got a rather large footprint for our public sector and our commercial sector. We have about 25 million lives on our platform. We have, of those 25 million lives, about 1 million of them are dedicated specifically to the public sector. That's states, local governments, school districts, universities, counties, cities, and what have you. We have 11 years with the State Health Plan of North Carolina. They're our largest customer, a very complex customer with a lot of different organizations and agencies. I'll talk a little bit about how that complexity comes into play here in a few. 9 years with the state of Florida. We provide them data analytics, advanced data analytics to help them drill down into their population's health to determine what types of programs and services they should offer and how impactful that those services are. University of Texas system we picked up in 2018, 14 institutions and an administration office. And for those who don't know, but the University of Texas system has some of the most worldly renowned medical practitioners, that we're very proud of here in our nation, and of course supporting as Benefitfocus. And we picked up state of Nevada, state of Wisconsin, city of Houston, Baylor University, and Williamson County, just to name a few in the last few years. And so why we like to start with this slide is because experience matters. If you don't have experience, no one wants to be that guinea pig. And so one of the questions that we're often asked is, do you serve people like us, and how can you leverage that service? But right here, this slide talks about what a lot of us already know, or at least feel every day. We all want to deal with these employer challenges. On the right side of the slide, let's just make it simple. Healthcare costs a ton of money. It doesn't seem like there's an end in sight to the increased inflation and high costs of care. It seems like every other day there's a new treatment out that's going to service some type of new chronic disease or an old chronic disease in a better way. And it's just expensive as all get out. And so all of these employers that we deal with, no matter what size they are, have a lot of these goals. They want to make sure that they can try to maintain that trend, not get those high sticker shocks. They want to improve their insight into their performance. Some of those folks, especially on the public sector side, have statutes and codes that require transparency and reporting. They need to be able to measure the effectiveness of the programs that they've gone to their legislatures or their city councils or their superintendents and begged, borrowed, and almost stole to try to get new programs during these tight budget times. And they need to show that level of success, be able to forecast and predict future costs as they build their budgets, increase employee adoption. High deductible health plans are not going away. A lot of people as members are scared of them, but they often work very well for a certain type of population. And then of course, what we really specialize in, that Ken's going to show you here in a few minutes, is how we provide those tools to make smarter healthcare decisions, not only on the member side, but also on the administrator side. Next slide, please. But really, technology in and of itself, sitting out there in the cloud, or maybe it's on your database, or it's in your server farm in your employer's technology little rack that you have there. It doesn't do anything if you don't actually try to move the needle towards getting better outcomes. So we can spend a lot of money, we can create some awesome tools for you guys to use, but at the end of the day, we need to move the needle, or what's really the point. And so there's a few different ways to look at it. You can look at it from the administrator side. If you are sitting there on paper, if you had hired a team of folks that are going to process enrollments every open enrollment and those life changes and throughout the year, those folks are basically, they're pushing paper. They're keying into maybe an antiquated system. They're having to set up file delivery to the carriers or to the other programs and services. You have to reconcile payroll and deductions. And a lot of this is a huge manual effort. So shifting those efforts away from manual enrollment into benefits administration by automation through the technology that we're going to show you today is one of the best outcomes that exists. You can analyze your new programs. You can track better population, whatever. I need you to go back, please, Piers. You can analyze better population, health outcomes, transparency, as we talked about before. But most importantly is to have sustainable technology model. If any of you are suffering, and I assume you are because everybody across the nation is, of the Great Resignation, people are walking away with institutional knowledge that you're having to try to backfill. And when you manage your own system, or you have a homegrown system that isn't being managed by a partner, that knowledge goes away, and it's like you have to start from scratch. So creating a sustainable technology model is very important. Expanding and contracting to meet your needs now and in the future. Today you have a health plan, and that health plan is serving your population, but maybe you want to do something later. And had you had that crystal ball that wasn't foggy, you would be able to understand the types of things that you could actually do in the future. And so once they become presented to you, do you have a partner that can grow with you? There's also, and this is one of my favorites, receiving enhancements to functionality by large organizations. If you remember on a previous slide, I said we take care of the state health plan in North Carolina. They are massive. And when they want something new functionality, a new enhancement, they often pay for it. And then we roll it out to everybody else in our book of business. And so you get to kind of ride the coattails of some of our larger customers and get the types of functionality as if you were a big fish in a little pond, even though you may be a little fish in a big pond. And it's a great type of indirect positive consequence to being part of a larger book of business. And last but not least, you can't do anything without true partnerships for strategic planning. You hear that the Phoenix Group is sitting there supporting folks at how better to manage their healthcare. We also do that with data analytics. We do that with assigned dedicated team to assist. We don't just build you a system and walk away. We're with you for the entire process. We even go so far as we assign a customer success manager at the beginning of implementation to learn all the pains of whatever you're going through. And then they keep you through ongoing operation maintenance. And so it's not like you have the A team that sells something to you, the B team that implements, and the C team that manages. It's the A team 100% through the life of the contract. So that's real kind of drink from the fire hose, but that's a brief overview. I think I'm going to go ahead. You can change the next slide, and I'm going to hand this over to Ken.
Thanks, Damon. So I think right before we get into the demonstration itself, I think we oftentimes get asked a lot about, just where does the benefits module kind of sit in the overall ecosystem? Like, where does Benefitfocus play with the different carrier relationships that we have, maybe reporting engines, as well as integrations with demographic and deduction information. So this slide is meant to give kind of a high level overview of, just where the, business rules and eligibility sit, and wanted to talk a little bit about some of the services that we deliver to our customers as it relates to data and ongoing support. So, over on the left-hand side, we frequently see a lot of organizations typically have, most of their information roll up into a centralized, core HR, demographic system of record, and payroll system. And so we're really able to seamlessly exchange data, either by file-based exchanges or APIs with those systems. But the overall business rules themselves live inside of Benefitfocus. And I think that's where, with our experience in managing complexity and leveraging a configurable application, we're really able to get very granular with the type of benefits that we present, the different rate calculations, eligibility groups, communication content, so that the application is really recognizing who that individual is when they access the system and presenting the appropriate information. There's other integration methods that we've leveraged for other organizations. Sometimes we have a central location that might have the, all the demographic information, but we also might have local employing units or different entities that have more of a manual process where they're keying new hires and changes into the system, but still allowing an application for self-service. So we're really flexible in our ability to be able to support the different ways that we can not only get data into the system, but also export that into various different payroll integrations or allow for payroll reporting for local or different entities themselves. Wanted to also talk a little bit about what you're seeing over on the right-hand side, and that's the different enrollment and eligibility files that we would manage on your behalf. So I think that's one of the key advantages. Well, oftentimes we, talk to an organization and they have entire IT teams that are really set up that do the system configuration. They build all the different data files going out to the various carriers that an organization is using. And our goal is really to take that work off of your plate and deliver that to you as part of an ongoing service. So not only initial implementation, but also ongoing system configuration changes, OE planning, carrier file setup and maintenance, even swapping out carriers, rates, and changes within the system. That's all something that we deliver to our customers as part of the ongoing services agreement. So we're able to leverage really that highly configurable and flexible architecture that we have to deliver, really world-class service to our customers as it relates to, not only their annual enrollment, which is always a, major event throughout the year, but also those changes that you might experience as you're going through your benefits planning on a year-round basis. So with, I think one other thing that we just wanted to mention too, certainly the chat is open. So feel free inside of the chat window to type in any questions, and we can certainly either address them as we're going through, or we can keep them for the end. We do have a Q&A section of the presentation kind of dedicated towards the end. So, would love to get engagement, feedback, and questions inside of the chat as we're going through. But without further ado, I think I'll take over screen sharing. And if someone just wants to briefly come off of mute just to make sure that you all are seeing my screen before I start presenting.
Yes,
we do.
Okay,
Ken,
great.
it's a little small. It's just a little small.
I don't want to zoom in too much, so we're not missing some of the key areas on the page. If it gets too small, if someone wouldn't mind typing in the chat, I can certainly zoom in through the browser. But I'm going to keep it the way it is right now, if you all don't mind. There's a couple of tips to make sure that you're in full screen Zoom and you've kind of hid the participants window to make sure that chat has gone away, and really the only thing that you're focusing on is the presentation itself. That should help if there's any visuals, but Damon or Rob, if anyone types in the chat that it's too small, please let me know and I will zoom in. So I think we'll start really the demonstration today by taking a look at the employee facing side of the application. So we'll be looking at not only the web-based enrollment experience, but also some of the mobile tools that we're able to deliver our customers. I think we frequently hear, as organizations are starting to make this shift towards modernization, that they're really looking for a self-service application that can start to consolidate some of the manual or paper processes that they have in place, and really leverage more of a year-round communication strategy that gives employees tools and flexibility to be able to not only manage their benefits on an ongoing basis, but then also on the back end support the organization from their complex business rules standpoint. So the end result of, really when an employee goes in and accesses the application, what they see is this configurable benefits landing page that we have a lot of flexibility to be able to tailor different pieces of content to different portions of the population or based upon their benefits eligibility. So everything that you're seeing, not only on this screen, but then also as we get into the enrollment experience, from the look and feel to the font and color schemes and logo, to the different sub pages and communication content that are displayed, that is configurable as part of the system. So, and I just got timed out because I was sitting on that page for a second. So give me 1 second to log back in. But we can really assist with making sure that we're rolling out a communication strategy that is relevant to the employee population while giving them the right tools to be able to access their benefits information as really a year-round communication standpoint. So a lot of our groups like to tailor this communication or some of the different subpages to different points, especially in an enrollment scenario. So when we have new hires coming into the organization versus life events that might be happening, or open enrollment, that communication might change dependent upon an employee's enrollment status. I think one of the other big wins that we really see is really that centralized repository of information, especially as it relates to communication. So we can make sure that we're allowing employees to kind of build a profile based upon their communication preferences, as well as emergency contacts. And then they can specify the way that they want to receive those ongoing messages throughout the year. So we've certainly started to see more of a shift from, paper-based communications to text messages, emails, and push notifications out to the mobile app. And this application really gives you the flexibility to communicate with employees in the method that they want to be communicated in. As we get into the enrollment experience itself, what you might see is, kind of this idea of one thought per screen. That's really our design methodology. So we're guiding employees through this, really this enrollment scenario to see that they can verify all the information that is associated with their profile and really get a better understanding of the different benefit choices that are being presented to them. And one of the ways that we can really enhance that decision support and education throughout the enrollment experience is a short survey prior to the enrollment experience actually kicking off. So we can use these different questions to gather a little bit more information around, what type of life circumstances this individual is, if they're planning any major events in the upcoming 12 months. But what we can also do is use a variety of different questions that might be able to drive rates or benefits eligibility inside of the enrollment experience. So if this is preventing a certain network of plans, if this is going to have a wellness credit impact to the different rates that would be displayed, those types of questions can be asked kind of at the front end so that when employees are getting into shopping for their benefits, they're being presented with information that's relevant to them and not having to sift through all the different content to figure out, what benefit they might be eligible for or what their rate might look like. Once we get into benefits enrollment in and of itself, again, we've really created an experience that allows you to not only present this information to employees in a very clean and easy to navigate format. But it also has a great opportunity to allow you to communicate things out to employees like company paid benefits. So with Damon mentioning kind of that great resignation, I think now more than ever, it's important that employees understand the benefits package that is being delivered to them. And so we can hit them with company paid benefits at the front end, while also supporting some of the administrative tasks that we often hear are challenges for an organization, like beneficiary management. So making these types of field required as part of the enrollment experience. These rules can be dependent upon the different plans that we have built into the application. And so we're really working with our customers to determine what that workflow should look like and making sure that employees have the right education and decision support, as well as the necessary business rules being enforced when they're going through and enrolling in their benefits. So as we get into our medical plan selection page, this is where we're really taking that education and decision support kind of to the next level with the incorporation of video communication, documentation, as well as data where employees are making the decision. So when we look at the different individuals that we'll be covering on this plan, you'll notice the plan rates would change based upon the coverage level. So again, everything is really contextual inside of the application, giving us the ability to present information to employees based upon the different pieces of information that they're selecting. I'd like to highlight too, as part of some of that decision support and education, some of the tools that you're seeing over on the left-hand side. So embedded inside of where employees are making decisions, our large employers can really take advantage of some of the pre-created communication content that we give groups access to. So this might be incorporated dialogue or educational videos that you can choose from our video library. Some of our customers have created their own communication content and want a repository to be able to house that. Others just simply want to provide links out to a provider or make sure that a doctor is within network or use their own content. So these pages and what we're communicating out to the employee is something that is entirely configurable as part of the enrollment experience itself. The other tool that I think is really important and where we're seeing a lot of migration towards is being able to incorporate data in the way that employees are making decisions as part of the enrollment experience itself. So what's great is that we can incorporate a couple of different data sets into the decision that an employee is making. So when we look at the different plans that an employee might be eligible for, not only are we building in things like deductibles, co-pays, co-insurances, out-of-pocket maximum, so the normal way that employees are really able to see the different plan attributes of these different plans. But what we're able to do then is use those different data points to provide them with estimates in terms of a cost projection in an upcoming 12-month period based upon previous data elements. So there's different things that we can do to surface these data elements to employees, like provide national average benchmarking data, as well as a forecasting tool inside of enrollment. So employees can use these little sliders up the top to kind of model out different scenarios based on utilization or if they're planning a major medical event. And you'll notice that these estimated annual cost numbers at the bottom actually change. So what we're doing is really crunching the number for the employee, taking into account their healthcare utilization benchmarked against the way that the plan's designed, coupling that with premiums associated with that plan, and then any employer contributions to consumer spending accounts or tax savings. So it really does paint a very clear picture to employees on what their estimated spend might look like in an upcoming period. I think the last thing I wanted to mention is we also have the ability for self-insured groups to be able to bring in their data sets to show actual spend over a previous 12-month period. So I think a lot of our customers are really looking towards bringing that data inside of their benefits administration technology to be able to surface. That is a decision support tool, and it also powers some of the analytics and transparency tools that I'll show you once we get into the administrator role. You'll notice then too, as I'm going through this enrollment experience, based upon the choices that I'm making as part of the plans that I'm selecting. So whether it's a high deductible plan that's HSA eligible, or a traditional PPO plan that's FSA eligible, our system can recognize these business rules and give employees flexible ways to contribute to these spending accounts. I think one of the key advantages that we have here is we also build in pay frequencies and pay calendars. So when we think about enforcing the maximum contribution rules inside of the enrollment experience, so when we're thinking about things like data quality, making sure that employees aren't enrolling in plans that they're not eligible for, or meeting those contribution limits and not exceeding those contributions, we have those different data sets built within the application to really validate those business rules. So when employees are going through and making those elections and designations, it's really easy to be able to, just key in the changes that they want. And then every time they go through a benefits period, they're able to get that summarized page of what they've enrolled in, the different dependents that they've covered, a shopping cart summary, which shows the different benefits that they've elected into, as well as the cost, or, what the deduction might be coming out of their paycheck. So it's all in that same spot. And as employees are going through this enrollment experience, I think what's also nice is we're saving their progress. So if they start the enrollment experience, but they don't actually finish it, they can log into the application at any time. It saves their progress during the enrollment experience so they can pick up right where they left off. As we kind of continue through this enrollment experience, I think one of the other key advantages that our application really is able to highlight is the ability to build in not just your core types of benefits. So I think traditionally other providers have struggled with being able to offer additional voluntary products like accident, hospital indemnity, other worksite products. What we've seen in the industry is kind of linking out to different systems or enrollment that's not in the same system. So we've invested a lot of money into really making sure that this experience is as seamless as possible for employees. We've gone so far as to establish preferred vendors that we work with that have enhanced integrations like high guaranteed issue products, integrated evidence of insurability, with the ultimate goal is to really alleviate a lot of that burden off of the employee's plate, so they're not having to go to different systems. They can get access to plan documentation, see what these policies cover, and if they want it, they can simply add it to their shopping cart, and there's no additional work needed, both on the employee side or the administrator. And then when it does come to those different types of plans that require evidence of insurability, we have a pretty extensive catalog of providers that have integrated evidence of insurability. So when we start thinking about things like voluntary life insurance, we can certainly enforce the business rules that would be associated with these types of products. Every organization enforces their GI versus pending rules a little bit of a different way. So we can support those business rules and pen transactions, require beneficiary designations. But again, with some of those carriers, even offer enhancements to the EOI process where they can actually fill out a health statement inside of the enrollment experience. And I think that's what we really see as a lot of groups kind of migrating towards some of those carriers that have those technology advancements that really create this seamless experience for the employees, so that enrolling in their benefits is just as easy as possible. And as we're finishing out the enrollment experience, I think one of the things that we're also able to do is kind of offer these additional, optional benefits. So a lot of groups we are really starting to diversify their benefits portfolio and start expanding beyond just your typical core benefits into things like pet insurance, college savings, student loan refinancing. So we have mechanisms to be able to present these types of benefits in the enrollment experience for the employees, not only during OE, but there's also mechanisms where we can offer these types of coverages to anyone throughout the year. As you see here at the end of enrollment, anyone that we've covered on these plans would be summarized for the administrator. So it gives you the ability to just have one last look from an employee standpoint of any of the benefits that they've enrolled in, the plan details. A lot of our customers like that they can self-generate a confirmation statement. So if, those individuals want to print a copy of their benefits enrollments for their own records, this is certainly available. It's also available to administrators to be able to go in and self-generate those confirmation statements. But I think as we start migrating towards, kind of that self-service and digital modernization, what we often find is that access to your benefits is really something that can be delivered year-round through access to the web portal, which I've already showed you, but also inside of the mobile application. So inside of our mobile device application, which is available on both Android and iOS, employees can not only go in and see their current enrollments, but they can also drill into these different enrollments. So if they have a question on their benefits, there's visibility into the ability to store a copy of their insurance card, watch these educational videos, even link out to a provider where they can access this information inside of the mobile app. So it creates a really seamless experience for the employees to be able to go in and access their different benefits. There's also those communication tools that are available year round that I'd shown you when we first accessed the application from the web view, but it gives us the same type of level of detail, so we can see all those plan documentations and detail that we might need to access to be able to answer questions on a year-round basis. But I think the biggest takeaway is that all your benefits management can be done on the mobile device. So you can go through open enrollment, you can make a life event change, you can modify your HSA or update beneficiary designations, even come over to your account section and upload documentation for someone that has a pending life event. So kind of keeping in line with these birth certificates that might be uploaded or marriage certificates. A lot of organizations that we work with really struggle with being able to create some of those follow-up tasks. And as we had mentioned at the front end, those emails, text messages, and push notifications can actually be generated for the employee to automatically kick off if there is a pending task that is needed. Once, now that we've kind of wrapped up with the employee view, I'm sure a lot of you are asking, so what happens to the documentation on the back end, or how do administrators kind of get access to these tools? So I'm going to shift over to the administrator portal right now to give you just a view in some of the tools that I think our groups really like. So as we've logged in as a system administrator, now what we're able to see is the ability to really use different dashboards and widgets to surface action items that a system administrator might need to put visibility on. So when we're looking at our to-do list, anyone that's violated a business rule, whether it be, pending life insurance coverage, missing documentation, or individuals approaching enrollment deadlines, whether it's new hires or during open enrollment, we're able to surface these tasks to you. So you don't have to actually, run reoccurring reports or create your own dashboards. All of these dashboards are pre-populated with the data and the business rules that we have configured. But what a lot of our groups like is that we're giving you transparency into, real-time plan adoption. But what's great is being able to drill into these reports on a little bit of a deeper level and see who these individuals are. But I think the most important takeaway is that we're also giving you the ability to do something with this data. So if you wanted to grab this list of individuals who are approaching an enrollment deadline, come up to the actions tab up here, you can export it as a report, but you can also start to leverage some of the messaging that exists within the application. So this allows you to create an on-demand message that would trigger out to employees based upon their communication preferences. Again, email, text, push notifications, but we're also giving you some flexibility in terms of who we're communicating with. So a lot of the groups that we're working with are actually opening the application to allow their employees to create a dependent login that has view-only access. So their spouse can actually log in and see what their current benefits enrollment are, and they can also specify communication preferences. So up at the top here, you can see we can select who's going to be getting that message. So there's a lot of flexibility that exists inside of the application to be able to give you the different tools to engage the employee population, whether they're approaching an enrollment deadline or creating a task. But I think as we go into the messaging center a little bit more, what we now start to see is a lot of things like messaging automation, or using this tool to be able to foster better utilization of healthcare, reminders of different wellness programs or point solutions that exist inside of an organization. So I'll take this opportunity to give you an idea of some of the event triggered messages that we frequently see. So when you look at some of the rules that can be configured inside of the system to notify employees based upon age. So maybe someone's approaching retirement age, maybe someone's dependents are approaching age 26, maybe someone has initiated a life event and we want them to automatically get a message off based upon when they initiate that event from a self-service standpoint. There's also different messages that we can really look at, such as someone's changed job classifications and that's opened up a new benefits package to them and they need to be able to go and access that information. But really the point is we want to give you the tools to start to be able to manage by the exception, not the rule. We want to, be able to enable these types of communications to go trigger out to the employees without HR admin teams having to intervene on all of these different one-off messages, and then give you the flexibility to do things like reporting on these messages and communication preferences. So it gives you really a flexible way to be able to create those reminders inside of the application, or advertise new benefit programs that might be being presented out to your employee population. So two other sections of the admin tools that I think would go a long way in taking a look at. The first of which is just overall employee access on the employee record. So when we look at an individual employee record, we do store all the historical content on the employee's record, so their current enrollments. But it also gives you flexible tools to be able to manage this member, whether it's extending an enrollment window, keying in a life event change on their behalf, making an adjustment to their benefits. You can even replicate what they would see in the member experience. So through this view and member role, up at the top right-hand side of the screen, we can actually see what an employee sees as part of their enrollment experience, but it certainly gives you all the auditing tools that you would need access to, like what type of dependents have been uploaded, if there's missing documentation, when that documentation is uploaded, and has it been verified or not. And then that historical history report down at the bottom here kind of gives us an audit trail of all the activities that have transpired on an employee's record. So we get a lot of positive feedback that it's easy to access this information on an individual employee level and to be able to support the population on an ongoing basis. And I think speaking of access to data, we can kind of wrap up from that perspective with a couple of the different reporting tools that we're delivering to our customers. So, first the first thing I wanted to talk a little bit about was the standard reports that exist inside of our application. So again, we frequently get positive feedback that the reporting engine in our application really streamlines this process because there's a lot of reports that our customers are running on a recurring basis. So through our templatized reporting, we still give you the flexibility to be able to access some of these reporting templates, but not too rigid to where you can't kind of slice and dice the information based upon your reporting criteria. So this gives you the opportunity to do things like filtering by location or employee status, benefit types, or any of the other eligibility drivers that we have built into the application. So it's a great way to be able to not have you create these reports from scratch, but still give you really flexible access to your data kind of at the front end. The other element of reporting that I wanted to touch on was something that, Damon had touched on as we were kicking off the meeting itself, and that is the overall access to trends inside of an organization. So as we start to continue to see healthcare programs continue to rise, organizations putting out different point solutions and really wanting to have better visibility into how their vendors are performing or how they're designing their plans, we really want to put that into our customers' hands and give you an agnostic data source that contains not only your benefits enrollment data, but also your healthcare utilization data into a single reporting application and architecture. So we're able to deliver these types of aggregate level reports as well as detailed level reports to you And here's just a couple examples of, what some of those reports can actually look like. So it might be monitoring our population for overall top cost spend, or, what are the top services that we're experiencing. What's great is, you have the ability to filter out by any different employing unit. So if you're, a large entity managing 200 to 300 different employing units, and you wanted to take a look at the health of, a couple of those specific locations and see what those particular locations are actually costing you. It makes it really easy to be able to flex, really slice and dice these reports or create flexible different reporting schemes based upon these different data sets. I think some of the other trends that we're seeing inside of our customer base are introducing things like point solutions for like diabetes management, weight loss programs. And so some of these dashboards really give you the tools to be able to monitor the effectiveness of these applications inside of an environment. So we can look at different reporting metrics as to when they were implemented, a year ago versus their effectiveness over the last year. We can also look at things like emergency room visits. So I think, COVID especially really exposed, some of the higher utilization or people that are at risk inside of an organization. It also made us take a look at things like primary care physician designation and how few employees sometimes are really designating those primary care visits inside of their employee profile. So what we found is that a lot of people were using the emergency room in a lot of our customer base rather than going to a telehealth, using telehealth or going to a primary care physician. And so this is, again, just some of that cost transparency that can be presented to an employer group to see these types of trends. And then what we oftentimes see is, really using these tools in combination with their broker and consultant to be able to make those different decisions inside of an organization. So maybe it's, what do we do to better communicate with our employee population? Well, the good news is we saw in the application, we can use our messaging center to be able to come and advertise programs like telehealth or wellness programs that exist. Or maybe we're having a more strategic conversation with our medical vendor to make sure that they're keeping monitoring on our chronic condition compliance. So I think, again, to put a bow on it, is what we really see is we're bringing all these different data sources into a single application that not only allow for the tactical benefits administration, but also the strategic planning of an organization as they move forward. Takes me through everything that I wanted to get to from a demonstration standpoint. I'm going to go ahead and stop sharing my screen. I think we just have a Q&A slide that we can throw up on there and see if anybody on the line has questions or thoughts, feedback on the presentation.
I don't see any in the chat, Ken. There's a few questions that I will say that I always get, though. One is for our SAP customers. Do you have to be on SAP SuccessFactors Employee Central in order to utilize Benefitfocus? Or if you're on an on-premise environment, can you utilize the tool?
Yeah, I think that's a great question. I think as we kicked off, certainly our platform is agnostic. We can integrate with multiple different environments. So this is not exclusively an Employee Central tool. This is really for any environment that has SAP.
What's your typical implementation timeline?
So, depending on complexity and an organization's really goals, I think we typically recommend about 150 to 180 days as part of an implementation.
Hey, Ken, this is Damon. I know we get asked a lot of questions on demos, and one that I think you and I fielded a bunch was, thanks for showing all of these awesome features and functions, and this looks really amazing, but what if we're not quite ready to do all of this? How can we have just some of this stuff that we really want, and how can we set up getting this stuff later, i.e. the configuration story? Do you want to talk a little bit about that?
Sure. Yeah, I think that's a good piece of feedback too. So, the only thing that we can really deploy a lot of the tools that we've talked about in segments. I think the good news is that core enrollment and eligibility is really a majority of what I've shown everyone on the presentation today. There's certainly additional services that some of our customers take advantage of, like employee call center, billing, COBRA, ACA administration, all those different things, because it's a configurable environment, can be deployed in kind of phases. So if you're, looking to modernize with the employee experience, and then maybe in, 6 months to a year, you wanted to add additional products, it's really seamless because we have the core foundation of that implementation already established. So we can help organizations grow as they continue to grow in their needs.
I know another question that I get asked a lot is, how can we help pay for some of this stuff? We know this isn't free. We know you guys have a great reputation in the industry, but we know that this is going to cost us some money. And what can we do to offset? And traditional answers, I'll kind of answer my own question, but traditional options exist. We have, there's the cost of not doing what you're doing today. So if you happen to have another system, or you're spending a lot of time and effort maintaining on-site equipment or on-site solutions that you can repurpose, or maybe the cost of your team, being repurposed to another function within the actual organization, there's those soft costs. But hard costs are often available through things like, we do dependent care audits. So you may have a number of dependents on your health plan today that truly are ineligible and should not be participating, and they are costing you a lot of money on your plan. And so we often find ways to offset costs with that. As Ken walked through a pretty detailed explanation of our data analytics, our health insights, you'll start to see certain things within that data set, getting those reports that, if we just tweak the plan here a little bit, or we make a change here, or we start pushing out more communication for compliance on chronic disease maintenance medications, or some of these things, you're actually able to start saving money on the health claim side, which then reduces the rates that you are actually paying. Say if you're fully insured, or if you're self-insured, it's direct money back into your bank to help offset some form of modernization, with someone like Benefitfocus. So we often have to build business cases with the customers that would like to purchase our solution. And we're very well adept at finding ways for you guys to be successful if the budget is a concern.
So I think we're a few minutes over time. We can go ahead and end the session. I do want to say thank you to our partners at Benefitfocus, as well as to customers that were on the line today. Just to let you know, I will be sending out this presentation along with our contact information. We're more than happy to schedule additional time with you guys for more of a deep dive demonstration, or just a discussion around your benefit process at your organization. So with that, I think we can go ahead and end. Thank you so much.